Welcome back. Here today on the beautiful campuses of Florida Panhandle Technical College, visiting with Miss Shirley Morris, who heads up the nursing program here at the Technical College. There's never probably been more of a need for health professionals, certainly nurses. And Florida Panhandle Technical College does a wonderful job of turning out many skilled people, many people who are taking advantage of the certification and the diploma programs here. But the nursing program is one that we've been wanting to feature for quite some time. And we finally got Miss Shirley to accede to our request for an interview. We're here today on the campuses to talk about the nursing program, which we're going to do when we come back. Welcome back. As mentioned today, our guest today is Shirley Morris, Director of the Nursing Program here at Florida Panhandle Technical College. First of all, I know you're extremely busy, so thanks for taking a little of that time out from your day to talk about the nursing program.
Well, thank you so much for all that you do to promote our program.
It's my pleasure, and you make it very easy, you collectively as the instructors here, because most people don't realize, first of all, the criteria upon which the programs here are judged. First of all, you, as the instructor and the director of your program, you can't have that program continue unless you have enough students.
Yes, sir.
Unless enough students graduate.
Yes, sir.
But the most important component, and really what we're here to talk about today, is the fact that you place those students in well-paid jobs and meeting the needs that the workplace has, in your case, for nurses.
Yes, sir.
Let's start with the nuts and the bolts. The nursing program here, you've got a couple different kinds of, you've got components, you've got patient care technology,
yes.
Then you get licensed practical nursing.
Yes, sir.
Let's talk about the licensed practical nursing. How long is that course in hours, and what would the average student coming into that program be expected to do during the course of that time?
Well, the practical nursing program here is a year long. We have two programs, one begin every August and every February of each year. I usually take approximately 24 students for each class. Now, prior to coming into the program, there is some criteria the student have to meet before they actually can come in the program. For instance, they have to be able to pass the T-score. They also have to be able to read. They require reading level that's set by the Department of Education. And then also we have like a medication calculation test that we kind of give a 2-day workshop and work with them, and they have to pass that, because let's face it, as a practical nurse, one of the things you're going to be doing is passing medication. And even though we do have the pharmacists who actually have it already calculated, there's a time when nurses have to learn how to calculate for themselves. So we want to make sure nurses know actually do the basic calculation of medication.
And obviously, it's always possible for people to make mistakes, and
yes,
the more checks and balances that you have between that medicine bottle and the patient's lips, the more opportunity we have to catch potential problems and to ensure the safety and well-being of the patient.
Yes, sir.
So approximately a year, and you've got them overlapping. So you've got two classes, and they're juxtaposed about halfway. So you've got every half year you've got one class graduating.
Yes, sir.
We've been fortunate enough, Shirley, to attend your graduations for the last several, and the thing that we appreciate the most, and what really hits us the hardest, is the look on the face of the loved ones, the spouses, the family members who see that daughter or son graduating with that diploma, more knowing that they're going to be fulfilled going into a well-paid job.
Yes, sir.
As we mentioned, there's always a need, always a demand for good nurses. Would it be fair to say that you place pretty close to 100% of your graduates?
Yes, sir, because one of the things I have in my program implemented is before graduation, the week of graduation, actually I invite surrounding facility from nursing home, hospital, and all they come in and talk to the student and tell them what position they have available for them. Now, they always need for to work. Sometimes the student may don't want to work because it's not the time. But like you said, it's a demand for it. And like we tell a student, you may go in and work the night shift and then get a day position later on. So these facilities are really very supportive. We have the surrounding nursing home and facility here in the Panhandle area that really work with us and actually place our students.
Well, like any other profession, you have to start at the bottom.
Yes, sir.
You don't start with the white shirt and a clipboard and just walk around and look pretty. You have to earn your bones, and you sometimes have to go to work for those dirtier jobs. But at the end of the day, those all pay the same, at least at that level in which they find themselves. This is an exciting program for me because, number one, I've got you here to talk about it. But again, we see these nurses, the most compelling photographic image that we've seen are when they're all holding the lighted flames and they're standing in a row. And again, you see tears on the faces of not just them, but their loved ones.
Yes.
You are very fortunate, I would dare say, in this community because you've got Northwest Florida Community Hospital.
Yes, sir.
You have Washington Rehab and Nursing Center. So right here in Chipley, you've already got some nursing facilities who you can do internships at or do your practical work. How does that work? What portion of that class year, during which portion of that class year are these students actually doing hands-on practice work in those type of facilities?
Okay, approximately about 6 weeks in the program, they start clinicals. So when they come in, we go through the theory, the book work, you learn about the skill, we go in the lab, we'll practice how to feed, do vital signs, transport the patient, et cetera, and then we go into the nursing home first, the Chipley Washington Home and Rehab, and then they actually do one-on-one with the patient, so they have the patient contact, because one thing about the technical education is that once the student leave here, they not only have theory and practicum, they actually know what they're doing. Most when you go to college, you have the book work, but you don't have that practicum. When you're at the technical center, you actually have the practicum. So when my nurses, student graduate and go to work, they are ready to work. They know exactly what to do. Yes, sir.
It's exciting. I didn't realize it was only 6 weeks into your program that these students literally start working hands-on with patients.
Yes, sir.
That's got to be a very strong part of the program.
Yes, sir. We want to make sure once they leave here and they go out there, they actually know exactly what they're doing. Yes, we practice in the classroom on the mannequins, and we actually, work along with each other, listen to heart rate and heart sound. Each student listens to each other's heart rate. But there's nothing like going in there and know, okay, when you work with your classmate, you're comfortable with them, but you go in there and, oh, this is my grandmother, my father. How do I approach this patient? So we actually get them in there and they get out their comfort zone and have their hands on. So when they actually leave the graduate from the program and pass state board, they already know how to deal with patients. And that is one of the things we do here.